Hello students and welcome back to scar massage and techniques. So here I have drawn a pretty massive scar on my forearm. This can also be, remember the scar can be anywhere. It can be on the quadriceps, the calf, wherever. It can be a post-caesarean scar. Important to remember is that it needs to be fully closed before you can start massaging. If the stitches are out, normally at about 10 to 14 days, they remove the stitches. The doctors, the nurses can remove stitches, and maybe one day if you work in the hand unit, you will also then remove your stitches, not yours, but of course your patient's stitches, right? Not difficult, just need to try it and learn the skill so that stitches are not left on the inside, that you get that little loop completely out. Right. So now going back to now a completely healed scar. Remember when you can see that after the stitches are out, the scar is nice and healed, then you can start by massaging. Techniques you will use are kneading initially, and then kneading towards, circular movements towards, right? So start right at the, it doesn't matter if you start at the proximal or distal end, but you knead towards the scar. Slow circular movements. Here you can use some ointment, but in actual fact, what you need is the movement of your finger on the skin. Can you see that the skin is moving? If you are applying too much of, let's say, oil, then you're just going to do this, and there's actually no movement at the scar at all. You need to get the skin moving to get that adhered scar better, right? Take your time. It's not a race. Don't do this. Slow and steady. Slow and steady. You'll see that I'm not on the scar because this is a recently healed scar. You complete it on the other side as well. All right. Towards it. Towards it. So massaging a scar can be a minute per centimeter. All right. So this one will take me about 5 to 6 minutes to massage. Right. So now let's say it's been 4 weeks. It's very adhered, and you have massaged. You've then already used your other techniques as ringing. You can ring the scar. Maybe you can start that, but very light ringing. You don't want to open the scar. Why we do kneading towards is if you pull away, you can open that scar. All right. So this will you can adapt as time goes on and the healing is better. Okay, so that's kneading, also ringing the scar, both directions, both directions with your two hands. I'm using one hand, but you will use two hands for ringing. Then also beautiful is a J stroke, so it's making a J and it overloops the previous J for jacket, right? J strokes, that side of the scar as well as on the other side. Doesn't matter the direction. You see the amount of skin moving. Then also, as time goes on, you can move more on top of the scar and you can knead on top of it. You can also then use rolling. Slow and steady as your rolling technique. No, don't rush it. Gather that tissues. Good. You will also give this for your patient to do at home. You can say you have to do your massage 3 to 4 times at home, and you can tell them you use a very small amount of Vaseline. Okay, so apart from massage, also stretching. Okay, you can do active movements. Here you see that wrist flexion gets that skin to pull. All right, you can also see if there's any other joint movements limited in range of motion. Elbow. Of course, you'll remove the jacket. All right. I'm just keeping it on for just this video. But you will then remove patient's clothing that you have the arm open. Right. Always ask permission firstly. Then you can also add passive stretching of that area. Can you see how that skin moves distally? Passive stretch. Keep that passive stretch for 30 seconds. Always ask, do you have pain? And don't, when you stretch, don't, ask them feedback. Do you feel it? Yes, I feel it there. Then stop there and hold it. Don't go straight down. All right. Slow and steady. And then you can do active work as well. And that will help for your patient with scar management. And this counts for all scars. All right. There's also Sika Care, Mepitac, silicone-based materials that you can add onto it. And that is for, often for keloid. Let me tell you what's keloid. Have you ever seen on top of a scar that it looks raised? Okay. So when the scar is raised up, but still in the margins of the scar, we call it hypertrophic scar. When it goes beyond the area of the scar, like this, and it's raised up, not this big, it can be just go beyond the boundaries of the scar, and it's raised. That's keloid formation. All right, so go and Google hypertrophic scar and keloid formation, and there silicone-based things like Sika Care, Mepitac is very useful. You can reapply it, and it's not just Sika Care is very expensive, so Mepitac. Go and Google those, and I hope this helps and believe it will help you in your future. Go for it. Bye bye, everyone.